Hyperventilation is an increase in the rate and depth of breathing. It is a normal compensatory reaction to a drop in oxygen partial pressure, for example if you're climbing a mountain, or when the CO2 level in the blood raises, for example if you're running. Without physiological need, for example flying a difficult final approach under bad weather conditions, large amounts of carbon dioxide are eliminated and the blood progressively becomes more alkaline. This decreases the amount of oxygen that can be attached to hemoglobin, since the hemoglobin is actually carrying some of the CO2 in the lung area. This results in less oxygen being transported to the cells. As a result, hypoxia can occur because you are hyperventilating. This diagram describes what happens in the body when you hyperventilate. It starts with increased alveolar ventilation with CO2 production remaining constant. This means hyperventilating and CO2 production in the body remaining the same. This results in a reduction in alveolar PCO2 in the lungs. This leaches out the carbon dioxide in the arterial blood supply. That has an effect on the pH of the blood, increasing it, resulting in a state of alkalosis, which results in increased neuromuscular irritability, and also cerebral vasoconstriction, limiting blood supply to the brain, and systemic vasodilation, increasing blood supply to the periphery. The reduction in arterial PCO2 leaches out eventually CO2 from the tissues, which also causes cerebral vasoconstriction and systemic vasodilation. Less blood supply to the brain results in cerebral stagnant hypoxia and eventually unconsciousness, which is not a bad thing because at least the breathing rate can then be controlled again. Causes of hyperventilation are arousal, strong pain, overstress or distress, fear, pressure breathing and anxiety. The symptoms are dizziness, visual disturbances, tingling in the fingers and toes known as paresthesia, nausea, muscle spasms and unconsciousness. There is no euphoria or severe headache or cyanosis, a blue tinge to the skin, as noted in hypoxia. The treatment is breathing into a paper bag, speaking with a loud voice, which controls your rate and depth of breathing.